Hello, everyone. My name is Danielle Blunt. I am a lifestyle and professional dominatrix. I am a pervert and a public health and technology researcher. And I am joined today with Dr. Avgi Saketopoulou to talk about risk, consent, trauma, and just one of her new books, Sexuality Beyond Consent. So I would love if you could introduce yourself and tell us a little bit more about your work and what led you to write this book.
Yeah. Well, thank you for inviting me. I'm very excited to have this conversation with you. I am a clinical psychoanalyst, which means that as my full-time work, I sit with people and listen and think about people's feelings and use myself as an instrument, so to speak, for tuning to all kinds of states and experiences and histories to be able to sit with people's memories, past, and experiences. And I also have an academic part to my professional life where I write and teach. And out of many, many years of sitting with queer communities and communities of people who engage in BDSM and kink and sex work, I have wanted to write a book that takes some of the very established psychoanalytic ideas and uses this knowledge that I've acquired to actually help us understand some things about psychic life that are enriched through the experience of queer people who live their lives in ways that are not in the mainstream, but who live in alternative communities.
I love that. I think it's such an important and urgent text and urgent conversation to be having in communities. Part of my background too in my organizing work is I used to work as a care coordinator for a sex worker organization, helping sex workers find sex work affirming providers. So I would do trainings at all of the teaching hospitals in New York for psychologists and medical doctors on the impact of stigma and how to work with sex workers. So both as like a clinician who is doing that work yourself and an academic who is writing resources for communities and educating another generation of psychologists and psychoanalysts, I really, really appreciate your work. And I want to share a little anecdote about how I was first introduced to your work, which I was taking this class, as you know, at the Brooklyn Institute for Social Research. I think it was called Sadomasochism, Economies of Desire and Recognition. And I was feeling very frustrated. I think partly because I was there to be I want to hear the theoretical readings that tell me information about what I felt somatically in my body and my experience of BDSM. And I felt like a lot of the readings that we were doing were interesting, but I didn't feel like I could really recognize myself or my experiences in these texts when they're talking about the death drive and obliteration as this end point. And I was talking to a friend of mine who is a psychoanalyst about how it just didn't feel aligned with what I knew to be true of BDSM, of this death drive having this very generative force where new things can grow out of. And she sent me a link to Suffer Pleasure, to a link to some of your work, and I read it, and I was just so thrilled to read something that resonated in my body, that I wasn't getting from the rest, from a lot of the text. And I went to go share this writing with the rest of the class, only to realize that you were the author and you were also the person sitting next to me in the class. And so I think being able to talk with you about these things, and I actually think that, correct me if I'm wrong, but I think that was at the beginning stages of you writing the book.
Or yes, it was at the early stages. I didn't even know I was writing a book then. Yeah.
Yeah. And so I think that was really fun to get to share in some of those conversations with you, and also just see where the work has taken you. And I'm so excited to have this conversation with you, both because we get to talk about the book, but also because I get to flex my own exigent sadism, because I don't really want to talk to you too much about theory, but I want to talk to you about practice. And so I hope that we can like start with a conversation about some of the key themes in the book and some of the key theories that you are proposing and talking about, and sort of where they come from, as well as how they're sort of how they can be applied, how you see them in your practice, how you might see them in clients who come to you who are involved in BDSM. And are engaging in DS play in any capacity. And so I really want to start by talking to you about traumatophilia, which also is just a word that I love, a very sexy word. So I'm going to read just like a tiny bit from your book. Traumatophobia keeps trauma inert, and that poses a problem because trauma that is not inserted into circulation does not wither and disappear. It stalls and it controls us. Trauma, I argue, needs to circulate. It needs to be revisited. And later you say, relinquishing the idea that trauma can be repaired opens path to thinking about what the subject does with their trauma. And I really love this idea of I feel like, first of all, I encourage everyone to read the book. It is incredibly seductive writing about incredibly seductive subject matters, and just draws you in. And you write about trauma and you write about overwhelm. And I think there's something really effective about your writing that sort of draws the reader into that state of overwhelm and excitement and risk of thinking about consent differently, risk of thinking about trauma differently, and risk of seeing themselves and their experiences in a different light. And so I think that that's something that's really hard to accomplish and really well done in this text. And I guess I'm curious about if you could talk a little bit about traumatophilia and how we are hindered by this obsession with healing trauma, what can be accomplished with playing with trauma, and what happens when we follow that impulse, because there is that impulse to touch that wound or to fuck that wound, you know. What are we both risking by not engaging with it, and what can we find?
This is such a fantastic set of questions because they go right at the core of what the book is about. Like that's the beating heart of the book. I should also say that when I wrote the book, I thought I was actually pretty clear that this was going to be the only book I write. It's not how things played out eventually. But because of that, I felt I really kept my own feet to the fire. And I kept telling myself, and I had a couple of really good readers who helped me with that, kept telling myself that I just need to say what I need to say without fearing how it will sound, whether it will make sense to others. Kind of like I really threw myself into this book, and perhaps that has something to do with the style in which the book appears, not just the ideas in it. But to go to your question, like as a clinician, I'll speak first from that angle. As a clinician, I was trained to think something that also circulates in wider culture, this idea that what trauma does is that it interrupts the subject, that it kind of like causes an injury that then, in order for the subject to be able to pick up and keep going, needs to be repaired. And that injury can be smaller or bigger. It can affect you in a number of different ways, cognitively, emotionally, in a bodily way, produce symptoms, and so on and so forth. And that the goal is, if the trauma was what interrupted us, the question is how to put somebody back on track. And I would say that, that there's many, many ways of being a psychoanalyst. I mean, schools in psychoanalytic thinking, but all of them share more or less that premise. And it's only very, very few moments in very few thinkers that actually deviate from that idea, to suggest, to give us some of the materials that I then use to assemble the notion of traumatophilia, which is based very much on a psychoanalyst called John LaPlanche, and which the main idea around traumatophilia is the following: that the trauma does not just disrupt us, even though it very much does that as well, but that it is also constitutive to who we become. That once we are thrown into a scene of trauma, there is no going back ever to who we were before the traumatic event. There is no restoration to like the moment, who we were before we were injured, before we were wounded. And not only that, but we're also drawn to our wounds. And we have, it's you asked like what can be accomplished by thinking traumatophillically, by being traumatophilic. And the thing is, people already are traumatophilic. Nobody needs to. When I address colleagues, I say you actually don't need to make your patients traumatophilic. This is more about the ways in which people appear in the world, but we don't want to see and we don't want to engage with. So oftentimes I found in my practice, especially in working with kinksters and people who engage in kind of like sexual practices that are not in the mainstream, that some of them turn to coil around experiences that have been difficult for them. And in classical clinical thinking, that is a problem. It means it shows that you are too stuck on your trauma, that you have not worked through it, and the goal is how to get over it. And I saw that this was actually not what was happening with these people, that new things were coming out of these kinds of experiences. So I became curious about what it means to think about the wound as something that has an attractive effect, to which some people give themselves over and some people resist for various reasons. So rather than wondering why somebody is drawn back to the wound, I became curious about the conditions under which one loses one's footing in the perverse and loses one's footing to allowing oneself to be drawn back into the trauma and seeing what one can encounter there. I contrast this with what I call traumatophobia, which is like, I should also say that traumatophilia comes from the Greek. It's a composite word that comes from trauma and philia, which is the Greek word for an affinity for. So traumatophilia is about having an affinity to trauma, whereas traumatophobia is about having a resistive relationship to trauma. And what I mean by resistive is to look at trauma and think of it as something that one is trying to eliminate or get rid of. So instead of thinking about what we are going to do about trauma, about somebody's trauma, about our own trauma, traumatophilia becomes more interested in what people do with their trauma. So it's more a thinking with model than thinking about how to excise something, how to eliminate something.
Yeah, I really appreciate that too. And I think when you're talking about when you're working with clinicians, it's not like encouraging the patient to be more traumatophilic. It's about, it sounds like what you're talking about, it's about creating a space where you can. Because I feel like from my experience, if the person holding the space, if the therapist, if the dom holding the space isn't open to that investigation, it really shuts it down. And if they are kind of guiding you to like repair, there's many different types of therapy, many which are based on repairing to a pre-trauma, like an attempt to repair to a pre-trauma state, which if you read your writing, we don't think that's something that is necessarily possible. But I think it's making me think too of like this idea of safe spaces, which is something that I've always had a really hard time with, and I think your writing has really made me understand better why I've been always so opposed to that phrasing. And I always knew that it was like, how can you offer someone a safe space when safe spaces don't always exist within an individual, let alone in like intra relationships. And I think that it's this conversation is making me think of like, how do we create a traumatophilic space, like where we are open to investigating your wounds together? And so this is something that has come up in conversation with me a lot with DOMs that I talk to. And I think so. I've done a conversation series with a few psychologists and psychoanalysts before, because pro-doms and sex workers are not therapists. Some of us might be and have like a separate degree, but largely we are not therapists. We are not trained in attachment and attunement and transference. And so I have a series of conversations trying to share some of that more clinical insight with sex workers so that we are better able to navigate some of what comes up when you are in this space of, having a professional kind of be a mirror towards you, and you are playing with these things regardless of if you necessarily know what you're doing or not. Just like the container of seeing a sex worker for a professional service and the container of seeing a therapist for a very intimate, relationally building service, but that still has certain boundaries. And um, I was really interested in having these conversations with therapists. And one of the things that came up was this question of the sex worker client, specifically like in a BDSM context, that is coming to see the dominatrix with the same scenario over and over again. And oftentimes, the scenario that we were talking about in these sex worker spaces would be the reenactment of a traumatic event or the reenactment of a traumatic event. And it would be very specific. And I had a lot of conversations with colleagues about, like, is this recreating someone's trauma? What is this scene doing for this person who can't seem to get out of this narrative? And sort of, I think I've I've gone through, like, I've been working for over 15 years in BDSM, and I think my perspectives have shifted quite a bit. But I think there was a time when I was like, oh, I'm not really very interested in doing that because I feel a little bit stuck as a Dom. But when I move more into a traumatophilic space of being able to hold that space for someone to really like plumb the depths of this wound, you really can see that even if from an outside perspective it doesn't look like something is changing, I feel like they're working through something that feels productive. And I guess so part of what you write about in your book is about like repetition and the compulsion to repeat traumatic past to create generative states of overwhelm, shatter the self, the good stuff, and like understand yourself differently and your relationship differently. And I'm wondering if you could talk a little bit about repetition and its relationship to trauma, and if there's anything in that anecdote of the sex worker client who is coming to the dominatrix with the same scene, like textbook scene, like a script to hand, and maybe some of how you would interpret what's going on there.
This is such a rich question because it touches on so many things. In fact, I've taken some small notes as you were speaking. So let me start from kind of like tracking what you were saying from the beginning. Like indeed, like part of my position, and I say this as a clinician, is that nobody ever gets cured from their trauma. Like I have not seen it. I don't know any colleague who has seen it. Nobody gets healed. Nobody gets returned to how they were before the disruption. So the question becomes, if we let go of that fantasy, what else can become possible in our engagement with what actually happens, as opposed to our story of what should happen, aka healing or repair? Especially at this moment in time, which is so preoccupied with the notion of the reparative. And the reparative has become like a real problem for us, both psychically and politically. Perhaps we can get to this later. But when you're talking, however, about how to create a traumatophilic space, or when you were talking about a container, certainly, like I'll speak, I don't do sex work per se, so I'll speak about doing clinical work. There is certainly a frame to the work. But the idea that that is completely a container misses something, which is that when you are working with two people, even as these people are in positions of asymmetry, like the analyst is there to attend to the patient, they're not there for themselves. The relationship of care is unidirectional, it's not mutual. Even though there's also mutual aspects of, like, you have two people who ideally develop some kind of connection with each other. The space is also necessarily leaky. And it's not as much of a container as we might want to imagine it to be. And what I mean by that, I'm not talking about abuses here. I'm not talking about exploitation. I'm not talking about kind of like the misuse of power that the analyst has over the patient, or that the prodom may have over her or their client. But I'm speaking about how you start out with a notion that you're creating the space as a clinician. But when you enter a deep therapeutic process with a patient, things come up in you as well. And you also get moved in directions that you did not expect and that you might have not been prepared for, or that you might have not consented to. And that's basically what you sign up for when you are working as a clinician. You sign up for that, for brushing up constantly against that limit of what you might have not bargained for, but you nevertheless get. And now you have to stay in the room and deal with it. And it is that commitment to stay in the room and deal with it that makes the space different. Not for me so much, as you were saying, the question of, say, space that some people are speaking about, or even in my mind, of a container that actually can really hold things together. So if I were to speak somewhat briefly about the question of how do we create traumatic spaces, I think that we create them by making ourselves passable, making ourselves susceptible to what comes up in us in an encounter with another. In other words, stepping into a space in order to curate an experience for another person can offer all kinds of things that are important and can have psychic depth and psychic meaning and can feel very meaningful to patients, for example, or perhaps, I'm sure, to some of your clients. But a traumatic space is an entirely different process because it involves also engaging with the opacity that the analyst has, kind of like the analyst's own opacity. So an analyst who steps into the space imagining that she knows, kind of like she's just puppeteering and pulling the strings because she knows how things work and she knows what's happening for the patient, but will never be able to sustain a space that is traumatophilic, because traumatophilia involves the analyst's own susceptibility to her own, to the unknowingness of herself, and a commitment to that which she does not know about, the patient, rather than having figured out the patient and just waiting for the patient to figure it out too.
Would you say, yeah, yes, but would you say that in any interpersonal relationship, that same thing is true? Like, I understand the power asymmetries that you're talking about in these situations, but I think part of the book too is that in any interpersonal relationship, that what part of what we are risking is that opacity in the other and the self, not just in these, I guess,
Yeah.
porously contained spaces where there's
Yeah.
leakage.
An interesting question because it makes a differentiation. I wouldn't say that. I would say that every relationship has the potential for that, but there's certain conditions for that to become kind of like realized or come close to be realized. Like, I'm thinking of a phrase that Jean Laplanche uses that I really love. He says, kind of like, what the analytic situation is a particle accelerator. And so the processes that happen in the analytic space are not unique only to that space, but the way that they happen there and the deep attentiveness that is given to them, and the fact that we train so meticulously to let them flourish and become actually quite demonic, to acquire the force of the demonic in the consulting room, is part of what makes a therapist space different than a really good friend who's listening to you and really kind of like is interested in your well-being. One of the commitments that at least I make in my own clinical work is to take seriously the fact that I do not know myself, not in the sense that something may be revealed to me, not only in the sense that something may be revealed to me about myself in the course of an encounter with a patient, but that when two subjectivities come together, when two psyches rather come together, like Wilfred Bion, like another psychoanalyst says, when two personalities come together, there's a storm. And it is the force of that storm is actually where the work happens, as opposed to the storm marking trouble. But that takes a particular kind of sensibility to be able to not just sit with the storm and tolerate the storm, but to acquire a taste for being in the space of the storm. And this is what I call overwhelm, as you were referring to earlier. So there is this kind of heightened, accentuated element to some situations that differentiate them from everyday life, even though these forces circulate kind of like any time to people, especially when it comes to like anytime two people are in concert with, in communication with each other, and the forces of the sexual get lit up.
The client who's coming to the pro dom to recreate this scene over and over again, and a little bit about what you see to be happening in a situation like that.
Thanks for reminding me. So there's a parallel, as you said, like the prodom and the analyst situation are not like the same, but we certainly see in the clinic people coming in and doing the same thing again and again and again. And I have like two sets of comments to make about that. The first is that, and this is an observation made by many others, not just me. I'll pick Deleuze, who I think is the most representative, that kind of like every repetition is a repetition with a difference. So even the thing that looks exactly the same is to some degree repeating with a sliver of a difference, and that sliver of a difference over time can actually produce a much bigger difference. So this goes to the impatience that we may sometimes feel with, oh, this patient has been dating unavailable partners like since like 3 years ago when we started working together, or 8 years ago, and they're doing it again. Okay, so it's easy to feel impatient about something like that, but the difference is always there. But the other thing that I would say is that the person who is observing the repetition and is judging that it is the same and is feeling impatient is not just an objective kind of like mechanical noticer of what's happening. And what they're noticing is not just the truth of the event. We also have our own resistances to noticing changes and to noticing how repetition is not just something that appears before us, that materializes in the room. It's also something that entangles us. Like, we are also participating in the patient's repetitions. Like, for example, just to take as a small vignette the example that you brought, like perhaps if an analyst who sits there and says, oh my God, here again, like I find this boring, like here we go again, like that experience of like here we go again might well be a repetition of the patient having encountered in their lives an object that again and again and again says nothing usable about them, like nothing important, nothing meaningful, and sees them as being too uninteresting or too boring. And if there is a dynamic of that sort, then in that example, we would see how the person in the asymmetrical relationship of in the higher part of the asymmetry, like the analyst or perhaps the prodom, is themselves participating in the repetition. That's why I feel that opacity in our own relationship to our own opacity and to our own unconscious is so critical to thinking about repetition and thinking about these kinds of encounters.
Can you talk a little bit about that opacity? Because I think it's something you go into very in depth in the book, but I think we've just sort of touched on. And I'd love to hear a little bit about that opacity and what you write about in the book.
Yeah. And I would also love to hear how what I'm saying is sitting with you. Like, what does it make you think of as I'm offering this potential read of that situation, for example, with somebody who repeats?
Yeah. I think it's very interesting, the conversation of like porousness of the container. I think about a lot, especially just like someone who is in psychoanalysis and goes multiple times a week. You know, like it does come up, some of the things that I encounter or that like move me in a way that I was not expecting when I am sessioning with someone. And it is absolutely true that I'm not consenting to that. You know, like not all of the time, at least, that I'm being moved in this way. Pieces of what my clients are going through rouse something in me that I might not have been prepared or consented to being roused in me, and then I have to, you know, kind of move through them and like get to an understanding that I can like integrate in some capacity in my life. But I think that's something that I've definitely experienced in my work, and I think there is a lot more, like, I think why I love having these conversations with psychoanalysts is there's so much more training in that frame, and like for you as a psychoanalyst to be able to figure out what to do with those things that come up and the ways that you are moved by a patient or a client in a way that I don't think we talk about enough in sex worker spaces. And I think sometimes we like pretend that we're not, I think is the easier way to do it, is you pretend that you're not moved. Something that I find very interesting too is like I find myself very drawn. I'm very into mommy play, and it's something that I feel like I can do a very good job holding a porous container for. And there are lots of reenactments. I'm sure both of my own stuff that I'm still processing in therapy, as well as what my clients are going through. And I think there's something about being drawn. That is something that I'm drawn to because it brings up a very specific type of interaction between myself and my client, and a very specific type of my sadism, of psychological sadism, that I feel like really just like cuts through so much. But it is this like deeply attuned work, deeply attachment based work, that I feel like in 15 years of doing this, I've gained so many more skills of not letting it go completely awry. And I appreciated some of the anecdotes in your book being about how you might have navigated a situation with a client differently. And I think that I've definitely had those experiences doing mommy play of being like, oh, now I understand what happened. And now I can approach this a little bit differently. But I think it's like this combination of, always being open to learning and growing, but also to being moved by that experience to go deep within yourself and figuring out why that happened, and the patterns within the dom as well, of like why I'm drawn to that, why I don't like being handed a script, why I'm being a little bit I am being judgmental when people hand me a script. I like a like very specific type of client, and I feel like it's a little bit different than psychoanalysis in that I get to brand myself in a very specific way so that people who are interested in the same things come to see me. But I think it's interesting to think about the repetitions of the psychoanalyst as well as the repetitions of the dom and what's coming up, and not just in the person who the space is being held. The porous space is what I'll call it, is being held for.
Yeah, yeah. I mean, the way that you're speaking about kind of like how we're moved, and kind of like what you've noticed in your own work about things that come up for you, like, this is precisely what I speak about when I speak about consent, because what I'm urging us to rethink is a notion of consent as the way that it has been presented to us, and the way that we're talking about it is kind of like thinking about consent interpersonally. And of course, that's very important, like the question of boundaries, the respect for boundaries. What does it mean for somebody to be violated? What kinds of communications mark a violation or a non-violation and miscommunication? All of these conversations are very important, and they fall under the premise of what like we call affirmative consent. But what I become interested in the book, and which speaks to the kinds of experiences you were describing, is the question of how consent is also an internal affair. It also has to do with how we respond to experiences that we did not anticipate. They arrive at the border, as I like to say, of our consent. I'm not talking about being violated. I'm talking about experiences that you did not agree to, you didn't bargain for, but they nevertheless arrived by happenstance, by contingency, because of what happened in the chemistry in the moment of the interaction with another human being. And then you can lean into that, or you can move away from that. And that begins to take us into the territory of what does it mean to think about consent as also an internal affair that has to do with how we treat our encounter with our own opacity. To take us to the question that you were asking about earlier. So when you say, that the move away from the notion of a container or even of a mirror, where there is a knowing person who knows how to implement something and they just implement it, as opposed to somebody who, in initiating an encounter, like, for example, we as clinicians initiate encounters by having an office and receiving referrals. That is an encounter, even if it is not addressed to a particular patient. Like, you're already
Cruising
there
for a
waiting.
referral.
I mean, people know that. Like, people there's many, many treatments in which I've heard, and I know colleagues have heard versions of, I know what I'm patient saying, I know what I'm doing here. I'm here because of my relationship with my mother, because of my problem with work, whatever. But what are you doing here? Why have you opened an office and are waiting for people to walk in? Like, what is this about for you? And that, I think, is a very important question. And it is an unanswerable question. It's an unanswerable question because however well you know yourself, there's always things about ourselves that escape us. And this is the most radical and most important meaning of the term unconscious. Today, the unconscious has been almost gentrified into being thought of as it is the unfamiliar that becomes familiar when you know yourself. Like if you've been through a good treatment, if you are really thoughtful and reflective on yourself, then you can know the things that move you and make you do things that you wouldn't have expected. And then you know them, and ta-da, now you can have some mastery over them. That's not really how the unconscious works. Like, there's part of why trauma is never resolved and why working through is an illusion is because our psychic life is always at a distance from us. Like the I that thinks, the subject that prefers, I like this and I don't like that, is always shadowed or interrupted is a better way of saying it, is always interrupted and intervened upon by forces that come from the self but are not of the self. And that's where things become really, really interesting and really tricky and really exciting. This is what we're drawn to when we're talking about traumatophilia, like these encounters with what is opaque in us, enduringly opaque, and which vibrates at a level of intensity and comes with an effervescence that can feel very lively and also very overwhelming and very frightening. For some people, it will act like a magnet, and for some people, it will really frighten them and kind of like they're out the door and kind of like really running away from that part of themselves. I don't know. Does that kind of like, I'm curious as you're here because I'm thinking so much with the psychoanalytic scene, and I'm curious what you're hearing and what I'm saying that might translate or migrate to your domain.
Well, I think what I was just thinking about was also with this idea that like trauma can be healed is this idea that it feels like a very reductive idea that we would be aiming to go backwards as well, and that we're not also constantly experiencing different forms of trauma and we're not constantly reinterpreting an experience. And I kind of see it like this like spiral of like turning shit up and integrating it to some capacity, and then that brings up something else and something new, and it's this I feel like there's a lack of movement in this idea of we can return to a pre-trauma state that feels incredibly stagnant and goes back to this like lack of being generative. And I think I'm very interested in neuroplasticity as well, which I think is another way when you're talking about these repetitions slowly creating way for spaces. I'm seeing like new neural pathways like carving out. It looks like it's like going to the same spot, and eventually it is going somewhere slightly different. It's taking you off of that path and it's changing the groove, and you're now like suddenly able to do something that you hadn't had access to before. And that's definitely something that I've seen a lot in my work. I feel like I also feel like there's something about the somatics of BDSM that can create change very fast. I'm very drawn to edge play. I love intense play. I love all of in both my professional and personal life. I love the play as you described that conjures like that more and more of overwhelm. And I think to be doing that play regularly with people, I really appreciate when the people that I play with are in therapy or have some form of self-inquiry practice, whether it be like yoga, meditation, being an analysis, so that they have that space and support that's not just coming from me to be able to integrate those things. But I've also had the experience of people reflecting back to me that they've made like huge movement in analysis because they've been able to put something in their body with me in a way that they're not able to within the frame of psychoanalysis, that they're then able to like take to their therapist and move through. And you have this very, the beginning of your book starts so beautifully with this scene of the slap. And I would love if you would tell a little bit about that story, because there's so much movement in that and brings up so much.
Yeah. I mean, the idea of movement and kind of like what is really so kinetic rather than the static of resolve something and go back to where you were and kind of like stay put. Not that that ever happens, but the fantasy, or even that we would have that as an aspiration. And I say this not wanting to diminish that people who are traumatized and are in pain just want it to stop. This is like very human. This is extremely understandable. And sometimes I feel like the bearer of bad news when I say, yeah, but it doesn't happen like that. Like it's not going to stop. It may start doing different things. It may get oriented in different directions. But to me, that feels more humane than kind of like the false promises that we have been fed about repair. So when you kind of like, so I have certainly had experiences as a clinician having a patient who has had experiences either in the context of sex work or in the context of BDSM with a partner that actually really throw what's happening in the consulting room kind of like off the spin that we were in, and it begins spinning around some different axis in a way that can be extremely generative, and therefore like some of what you're describing I've seen the other side of.
Yeah.
And I love what you're saying about kind of like how the two can work synergistically. So I think that that's really interesting. Now the slap, this is one of the, it's a story that a patient told me, and which of course I share with the patient's consent in the book and discuss it here with you. So the patient is somebody. So I work a lot with pervy sex in the book, and with perverts, and I really love using that word as kind of like a resignified way of like owning kind of like the agency and the pleasure that comes with sexual practices that have usually been degraded as and demeaned and being seen as not sexual but as pathological expressions, annexations of the sexual. And that is very compatible with thinking with psychoanalysis. So this woman is a pervert, and she's negotiating with a partner a slapping scene, and she tells me that she's telling me in a session that has experienced this scene with her lover who slaps her, and she says to me it was such a slap, like it was at the right part of my face, the right amount of force, the right look on her face, like everything was just incredible. And she says to me, this is not the kind of slap that I expected. Like I expected a mediocre slap, and what instead I got was a rather exquisite slap. And in response, she safe words. She safe words, not because her partner violated her limits. She has done nothing that is beyond the limits that they have talked about. She's actually very much stayed within the limits. She has just delivered this slap, which is so kind of like ecstatically superb that it becomes overwhelming for my patient, for whom sensations and experiences flood her, which are precisely at this phrase that I use, the more and more of experience. And at that moment, she is not consenting, not to what her partner did, but her own relationship with what kind of like really cataclysmically takes her over. Her own relationship with that is that she can't bear it, and she stops it. And that's a very different way of thinking about kind of like the withdrawal of consent, right? Not a withdrawing because the other person has disrespected us or trespassed us, but because we cannot bear getting more than what we asked for. And I think that's a really fascinating example of how to think about consent differently.
Yeah,
What makes about how are you thinking about it?
well, I wanted to move into a larger conversation around consent, and I think the two things about that story, talking about myself being a dom who's very interested in edge play and more risky spaces, I think having more complicated conversations around consent are imperative. I think BDSM is really lacking with safe, sane, and consensual, SSC, and RAC, risk-aware, consensual, kink, and affirmative consent. I think they're all useful tools, but for a very specific type of play. And if you are interested in encountering, as what you're referring to as that opacity, it's not something you can necessarily negotiate. Like what you're talking about in this client's experience is not something you could have thought to negotiate. And that's something that's come up in my play before when things have gone wrong. It's not always, but like it's not something that anyone would have considered telling me was a boundary. And I have this very vivid memory where I was like, I was very moved, very upset by the experience because I wasn't expecting it to go wrong, where I was doing a scene and it was involving mommy play. And I think attachment stuff comes up particularly easy when you're doing mommy play. That can be difficult to negotiate around because you might not know until it comes up. And I had my hand on a submissive shoulder and I took it off to put it on another submissive, and it turned into a very bad scene. We thankfully like stopped and were able to like come back together and like find a way to move through it. But you know, it wasn't something that they would have known to say until after. And so I think I feel really grateful that that scene was with someone that I really trust and have a relationship with and who trusts me, that we could, you know, I still use the word like rupture and repair because I don't think you ever get back to that pre space before it happened. But I think you can get back to a space where you're not getting back to a less disassociated state was very helpful in that experience. And so I think of both the responsibility of that sub for the internal experience, as well as what are my responsibilities as a dom, and how does your conversation around limit consent invite us to have more complicated conversations that aren't just about please fill out this checklist and say yes or no, which I also feel like sets people up for failure, because who can memorize like a 50 sheet checklist, right? Like I think like these SSC and RAC and affirmative consent are really, really limiting. I think they also limit the type of sex that we feel comfortable having and risk us being able to have those transformative experiences. I think that they're very useful, as you talk about in your book, about talking about consent violations. But beyond that, I feel it's very messy and oftentimes harmful to limit the complexities of desire and the self. And I'd love to read something from your book on limit consent and ask you a little bit about it. So you write that limit consent is not something that we exercise or something that is done to us. It has more to do rather with surrendering to another, or more precisely, surrendering to the opacity in the other and to the opacity in ourselves. Consent, we will see, is not only something that we offer to another, it is also an internal affair. While the usual paradigm around consent is about maintaining control of a situation, limit consent is about giving up control. And later you write, we cannot rely on the outcome of an encounter, what happened or how someone felt about it, to decide whether the encounter was ethical. And I think this is a huge leap in conversations around consent. I know I've spoken to so many DOMs about how this book has put into words things that we've known about the limitations of conversations happening in BDSM community, and help give us language to have some of these more complicated conversations with our clients and with our submissives. So we're talking about both consent as an internal affair, limit consent, as well as, you know, it feels beyond risk aware to, right? Risk aware to me means I'm going to use a scalpel for blood play. You might be at risk for an infection. This is what we're doing to mitigate those risks. And it feels much less about the emotional impact in the conversations that we have around risk. And I think it is both the responsibility of the dom and the submissive to be having those conversations and being, if you are engaging in that play, to be responsible for that which comes up within you and within the other. And I guess what I'm circling around, but what I'm trying to say is that I think it's very true for both risky play and for play that you might not consider risky, like me removing
Mhm.
a hand off of someone's shoulder or a
Yeah.
slapping scene transporting you beyond where you wanted to go. And I think like just knowing how transformative and generative those going beyond the edge of what your desire is for me has really turned into conversations about who am I comfortable doing that play with, and who do I think I can come back from something if I go too far. Because I've had experiences that I think we all like all people who've been playing for a while have, of something not going right, something not landing right. I shared one experience that thankfully was able to come back together, but that's not always the case. And I think when you are drawn to riskier play, um, there is more risk, not just of like harm that might happen to someone, but interpersonal risk as well.
Yeah. I mean, your comment touches on so many things that are incredibly important for this conversation. So I'm thinking of, so let's take this example, like you lift your hand off of that person's shoulder, and like there is the how could you know? There is the how could they know? Maybe they didn't know. And then there's also another thing which I think we don't think about either, which is that that same experience in another context, on a better day, on a day that they felt more connected with other people, could have meant very little. So it's not just about like that you didn't know, that person didn't know, well, maybe next time you know better. And next time, if they're going to have a sexual encounter, maybe they should communicate that to their top so that that doesn't happen again. It's also that there's so much contingency, and psychic life leaps before us. And it kind of like it's you can't catch up with it. Like you don't know, like you walk into a room and somebody's is kind of like cooking mushrooms, and the like actual mushrooms, and the smell of the mushrooms triggers an association that you never expected, and all of a sudden those things that you thought you were getting into and were okay are actually not because of the things, but because of the state that you're in. And these are not things that can be anticipated or predicted. So that's one very important point. Um, and it really highlights also the vulnerability of the person who is usually charged with being the guardian of the experience, and how incredibly vulnerable the situation is. I'll go back to speaking about analysis for the analyst. Like you would think, well, but the analyst is not vulnerable in the room. They're not the one bringing in their soul. They're not the one um, kind of like really pouring out their pain. But the truth is that when the work deepens to the degree that it matters in this way, and when you are willing to be in some kind of like in this space of limit consent where things are getting roused without you having agreed to them, and you have to sit with them for the purpose of actually working with somebody, you are vulnerable in ways that are definitely beyond what we describe in my field, and definitely beyond what I ever appreciated as a patient until I became an analyst myself. And I think that still we have a lot of trouble talking about it with each other, about how vulnerable the position is, because ostensibly we also are the people who are delivering the service, who are very, very highly trained for like tens of years to be able to do the work that we're doing. So the question of like where vulnerability sits in all of that seems very important to me. And the last thing that I'll say in relation to your comment is, you know, so this patient that I described, safe words when the slap becomes too much. Is it because this is not an experience she feels comfortable with? I wouldn't even go as far as that. I would say it's an experience that she cannot bear in the moment. It is and has been. I know kind of like about patients who have described experiences like that to me, that at other moments this very same experience can feel very different. it's also about what can arise in this is the big difference between limit consent and affirmative consent. Affirmative consent negotiates and sets limits or tries to produce experiences that one knows will feel good, or to avoid experiences that one knows will not feel good. But it has very little to say about experiences that we have that surprise us with how arresting they may feel. Like this person that you described by themselves have felt very surprised, but just lifting your hand might have been so upsetting. And I kind of like I talk about in the book about an experience that Tim Dean describes where he happens um, upon a pissing scene where he's the bottom, and instead of what he thought he was going to experience, which is that he didn't want that, he ends up having a really extraordinary sexual experience that he didn't negotiate, didn't agree to. He says very critically, he says, I would not have consented to this. And yet an experience arises that is not just sensually powerful and emotionally gripping, but it leads him to write a whole paper about it. And it has inspired other people, me being one of them, to actually engage with it. So all of a sudden, these moments kind of like can also be portals to all kinds of other possibilities that one cannot know ahead of time. And for that reason, kind of like affirmative consent, even kind of like the SSC model for sure, is very, very lacking. The problem for me with RAC is precisely in the notion of aware, because we are talking about going to spaces where kind of like awareness is just not going to cut it. Awareness is not enough. However aware you are, however smart, thoughtful, attentive, alert, it's not only the dissociated and those who are not deeply thinking about themselves that are surprised by their reactions. So I think that we need to do away with this binary of like awareness versus non-awareness and make room for opacity and for the unconscious.
What acronym would you propose? Opacity aware. Consent. Oh, you proposed limit consent, so I'll take that. I feel like there is that like right part of also like I feel like we need to expand what the risk is, right? Like that you might not always be aware of it, that you might get exactly what you want and it's too much is something that I've had experience, that in like your experience with a slap, that it is too good, it is not tolerable at that moment. You can't integrate it. It needs to stop because it's too much of the too muchness. Yeah, that overwhelm. And it can be none of what you want. It can be more than what you want. And I think also part of it, from what I've experienced, is that you're risking being seen in a way that feels like a violation. And I think of this a lot with humiliation play and some of the more edgy humiliation play that moves away from like specific tropes about like small penis humiliation, that's moving away from like what you see in femdom porn and more in what you can access when you have a personal relationship with someone and you grow. I think also in just being vulnerable in the scene, you're risking being seen in a way that can counter how you've seen yourself previously, that can create that state of overwhelm. And I think the same is true for the top. And you talked about it a little bit really eloquently about the vulnerability of the psychoanalyst, but I think it's something that we also don't speak a lot about is the vulnerability of the top. And I think it goes back to the idea that we are able to hold a completely confined space where none of our self seeps out. And I think moving to this idea of like more of a porous space, like an interrelational space that we are co-creating, I think can be helpful. And I think so much of your writing, I'm very curious about this. So much of your writing makes me think of my magical and witchcraft practices and this idea of, I feel like it is much something that I understand much better from my thought of facilitating a ritual for someone where I might be a conduit and be moved, or I'm channeling an energy that is both my own, a divine energy, as well as the energy of the person that I'm working with. And I feel like the language that you use to describe um, what's happening with a psychoanalyst, what's happening with a dom, what can be happening with the parent when they're playing with a child in this type of like liminal space, this type of like limit consent, is a very powerful generative magical force. And I'm curious, that also feels like really departs from westernized ideas of death and finality, which is what I was first drawn to in your work. I was completing my yoga teacher training at the time when I first encountered your work. And I was like, this, like seems so much more aligned with what I've been in learning in yoga, what I know about my practices of BDSM, than these very Western texts that we were reading in the class about that end space. And so I guess I'm curious, if you thought about that or what your relationship is to some of that.
Yeah. I mean, this occupies a very big part of the book, like this question about thinking about these forces that you were describing as magical, in which, in thinking with psychoanalysis, I'm describing as having like a demonic quality to them. And demonic here is not associated with a notion of evil, but with the intensity, with the kind of like Dionysian intensity, which is not within control, not within anyone's control, but which kind of like erupts and creates, kind of like magnetizes you. And so let me go back for a moment to say something to bring me back to that. Like I was making a note earlier when you were talking about the vulnerability of the top, and I was remembering like of a moment that I describe in the book, having observed an encounter between an adult and a child, a mother and a daughter. And the mother and the daughter are playing a game, which the daughter has orchestrated. And the game is the mother is supposed to be a monster. She's supposed to scare the daughter. She's been given very clear instructions as to how to do it, which is how 4-year-olds do it. Anybody who has a 4-year-old has been given a set of instructions of that sort. And so she kind of like scares her. And then the daughter says, stop. And she stops. And then the girl, Lumi, will say again, and the mother starts again. And they do this for a while. And then Lumi, the little girl, says to the mother, we're going to play a different game. You scare me. I ask you to stop, but you don't stop. And I pause there to think about not just what is the little girl inviting, but also what would it take for the mother, and what would it take for a person in that position to take it out of the mother daughter scene, which also has different sets of responsibilities, because we're talking about children who are developmentally not the place that adults are. We're talking about psychoanalysis, or even kind of like work with kind of like pro-dom work. What would it take for somebody to step into that contract? And I slow things down to flesh out that in order to, if we're assuming somebody who's like reasonably caring enough, nobody wants to hurt the other person in a way that will damage them. And yet, this is exactly what is being risked if that kind of encounter is going to be dared. So, in order to step into that kind of game, so to speak, and it's the kind of game that can extract blood, like emotionally speaking, it's not a ha-ha game, it's a very serious game. In order to step into that kind of game, the person in the mother's position has to be able to participate genuinely, not as if fake way, not like at a ha ha ha, like I'm going to scare you. No, I'm not going to stop. Like I'm like she has to like do it believably enough, and to do it believably enough, like she has to allow something in her own sadomasochism to get engaged. But of course, that force can always get out of control. That's what worries us, even as we hear that instruction, like don't stop when I say stop. Like, what if it goes too far? What if you say stop and then you actually do mean that the scene needs to be stopped, right? So the mother has to allow both something in herself to get roused in order to participate genuinely in the game, but she also has to push back against her own wish to keep it safe. Because the easiest thing to do is to say, yeah, we're not going to do that. Right? And most parents would say, we're not going to play that game. Now, in the book, I never say whether the mother participates in the game or not. But in patients come in the clinic all the time and say, I left my previous treatment because my analyst was not pushing me hard enough. I felt like I got away with all kinds of things, right? So that's not like there's a parallel between these two kinds of requests. And if you're going to step into that, just like and I imagine there are parallels in sex work and
I want to
pro-dom
be
work.
really dominated. The last dom that I saw was just performing the role. I want to feel
Right,
real surrender. I want to really feel your
right.
power, I feel like is the equivalent without it being
Okay.
necessarily named consensual non-consent play.
Yeah, yeah. So this is like a very particular kind of space, and for the dom in this example to step into it, she will have to be able to push back against her own resistances and her own anxieties about things going off the rails, while also trying to mind things not going off the rails. So she's courting forces that could get out of control, right? And that game proceeds in a different kind of frequency. This is not an affirmative consent kind of game. This is a game that has to work with follows a different kind of syntax, and where it's not just the question, as you were pointing out earlier, like people getting exactly what they wanted. It's also about desires getting produced that you didn't even know could get produced in you, appetites opening up, like possibilities changing in you that you might, after the scene or after the encounter, feel very differently about, because these happen on different psychic spaces, and this is where things get very complicated. So one of the things when I talk about Carmen, the patient with a slap that we were talking about earlier, one of the things that I emphasize is that Carmen is steady enough psychically that when she says, safe word, I don't want to do this anymore, and she feels overwhelmed, she does not turn that into, well, we said you were going to slap me with this force, but we didn't say you were going to do it with 2 fingers as opposed to 3 fingers, or with this part of your, like she doesn't find, she's not looking to ground that in some misstep on her lover's part. She's able to own and acknowledge that it is she who cannot bear how much this is. That's not always the case. That's where things get really, really complicated. But the way in which these kinds of encounters court forces that have intensities to them and exigencies that are not in our control is very much kind of like aligned to me with what you were saying earlier about like the kinds of forces that come out in these kind of like in some of your play when you were talking about kind of like the ritual and the magical force. Like some of these forces are very, very dark, and they can be frightening and also very exciting, and we're
Yeah.
drawn to them.
We want to touch the wound. We,
Yes, yes.
it's begging for it. It's begging to be touched. I think please bear with me while I work through this question with you, but we're talking about the complexities of consent, and we're talking about the limitations of affirmative consent. And if consent is also an internal affair, which I think is something really beautiful that you offer in this book, then the legal structures, which I think make us so attached to affirmative consent, really don't work. And I am coming from this as an abolitionist. And so I feel like I have kind of an abolitionist reading of your text. And so it felt very relevant to me, both as a BDSM practitioner and also as an organizer, and both your theorizing and understanding of embracing risk in sexuality beyond consent feels like a part of harm reduction and very aligned to like conversations that I know are being had in like drug user spaces of both like what are the risks and that you might not always know what the risks are, but like how can we, and some of what I've taken away from your writing is how can I have better conversations with people that aren't negotiating experience, but rather how can I have conversations with people that will allow us to come back together if something goes wrong? Like, how can I build and facilitate that trust so that we can risk intimacy is sort of how I've moved my frame. And so that feels very aligned with harm reduction, of reducing harm, because if you're just having conversations of do this, don't do that, and then it gets crossed, it feels much more complicated to come back from, especially within like the legal constructs of consent and being in a like litigious society, and as well as in Sexuality Beyond Consent and what you co-wrote with Anne Pellegrini, Gender Without Identity. You're breaking out of these legal constructs of both consent, sexuality, and gender that I feel like it disrupts the idea that these internal and relational experiences can somehow be governed by law. And I guess I'm curious about how you see your work being related to harm reduction and divestment from the carceral state and moving outside of those legal structures, how it can change how we negotiate intimacy and how those legal structures are really limiting in how we can be really limiting in how we approach intimacy
Yeah.
between people.
Yeah. I mean, I'm going to say something. It's a really interesting question, especially when you think about it in the context of abolition, which I had not thought about. So that really is fascinating to me. I mean, look, like to some degree, kind of like when you were talking about risking intimacy, that sounds exactly right to me. And this is a very particular kind of intimacy, and it comes with kind of like a pretty big assumption. You know, there's a difference between, I mean, we all know this. I'm just going to say this very explicitly. There's a difference between there being some, like in the affirmative consent model, between there being something that you, like you smelled the mushrooms and it changed and you didn't know and you didn't communicate that and then you felt violated, as opposed to you said, don't touch X and the other person touches X. And you say, ouch, we said, don't do that. And they're like, why? You really like it. Like, so obviously, like these are very different kinds of situations, right? But here's the tricky part. And this is very easy to misunderstand. So I wanna say it in a couple of different ways to avoid misunderstanding as much as possible. Encountering each other at the limits of what's bearable is also an incredibly intimate experience, especially when both people stick around, not to repair or to get back to trusting each other, because I am of the belief that kind of like that relationships are made of many, many, many ruptures that are not repaired, they're just held together by Scotch tape. And that Scotch tape is very important. And I use the word Scotch tape to indicate that they can also come apart very easily. But that's the best we can do in relationships. There are no relationships where that does not happen. For me, intimacy is about what happens after the rupture. It's about what happens after the moment where, not where you said don't touch this and the other person touched it and kind of like tried to make not a big deal out of it, therefore also kind of like humiliating you on top of having violated you. But from the perspective of like you risk an experience with somebody, you step into something and the other person sticks around for the moments that it doesn't go well. Because when I'm talking about risk, I'm not just saying this kind of like theoretically as in take the risk, it's gonna go well if only you are daring enough. I actually mean it quite seriously. These are risks. They put people in positions where they are extremely vulnerable. And that's why, part of why I'm saying that what I'm talking about is not a how-to or a manual, not even is it a suggestion, is because people take risks at their own time, of their own volition and of their own readiness, not as a result of anybody encouraging them to. That's the kind of risk that I'm interested in. And that means that risk can sometimes take you into a really difficult place. But for me, intimacy is about what happens once you're in that difficult space. What happens if both people stick around to be present, not for repair, but to take inventory of what happened and to stay true to stay awake to the truth of what happened. So this is not about over punishing somebody, and it's not about kind of like sweeping things under the rug. It's about giving it its proper place and its proper weight. And to me, that's a big part of what trust can mean.
I was gonna say, I feel like that moment of deep intimacy that you're talking about after a rupture is also that moment where there is the potentiality to shed a little light on that opacity within yourself and within the other, of if you are able to share like what that was, if you know, if you
Mm.
know in the first place. But I think being able to sit there and share in that moment, it is such an important part, which is why I think aftercare is an important part
Mhm.
of play as well. But I think also it's not just like the physicality of it, it's being there for those conversations, and like I think that curiosity as well. And I feel like we risk so much too in not risking, because we're risking not
Yeah.
knowing ourselves. And of course there's like, it's different for everyone at your own rate. And I do think affirmative consent is really, really great. I've done some like really amazing affirmative consent scenes with like aggressive affirmative consent with people who've experienced boundary violations, and also like was a very like profoundly moving experience for both of us, to be able to use that. And I think there's so much utility to these structures of consent until you are trying to explore things that you might not be aware of together. And then I find them very lacking.
I mean, I know that I know that you don't mean it this way, but I want to be very clear that when we're talking about having these conversations, like these are not pleasant conversations. They're
Yeah.
actually really, really hard conversations. They're painful. They can make I mean, I'm thinking of moments where with patients, I have done something that has been painful to a patient inadvertently. And then I realized in the aftermath that actually, very much like you were saying, there are things that you come to understand about what was happening in me, that I said it this way when I should have been able to know that it might have sat the wrong way, or I didn't know it, but why would I participate in this particular way? And then that person gets hurt. Um, these are kind of like very humbling moments, and kind of like you really put yourself at the mercy of the other person's, not just generosity and willingness to partake in the endeavor, but also in their capacity to be curious about it. Because of course the easiest part is always like to recoil into the "you're bad, you hurt me, stay away," um, and to try to stay present for that space where you're actually trying to magnify and look at an encounter of that sort is extremely vulnerable, and it marks relationships forever. These things never go away, and that's not a problem necessarily. That's not a problem. This is what gives relationships their density and their texture. But one of the phrases that I use in the book is that it has to involve the willingness to step into the fray together, and that's a very big step to take.
It's very interesting because I feel like I've only heard language like this in abolitionist spaces and transformative justice spaces, are the only places that I'm hearing this language and these conversations outside of your writing. And I think that's why it strikes me as such an abolitionist, or the potentiality to be such an abolitionist text, because
Mm.
we're saying like the law cannot define our intimacies. The law is not suited to be able to define our intimacies, and rather than trying to use the court to define when things go wrong. The court cannot fully or meaningfully in any way address harm either. It is not the space to do that. And what you're talking about is this very radical idea of sitting in these very tough moments and risk being vulnerable enough to share that someone hurt you and how they did, and being open enough to realize that you are a person who can do harm, which we all are capable of doing harm. And
Yeah.
these are things that I have only learned in abolitionist and transformative justice spaces, of being able to like really risk that vulnerability of showing up in relationship and in community. And so I think there is a reading of this book that kind of really
Mm.
hits on some of those things for me.
No, that gives me a lot to think about. It's so fascinating to hear you say that, because because I absolutely, like, I've always thought that that the law is absolutely, like, legal frameworks do not have the elasticity or the emotional dexterity to manage the complexities of psychic life and of psychic time, which is not linear, which is kind of like has a spiral, kind of like it works with in the après coup, it works with afterwardsness. But I had never thought of the abolitionist context in this way. And as I'm hearing you say more about it, like I see where you see the affinity between the two, and I'm really intrigued by that.
Yeah, I feel like there is a lot in all of your writing about gender as well. I feel like it feels like a through line for me
Mm.
in a lot of it. Or at least also that's what I'm picking up from as an abolitionist who doesn't think laws are real. Like I
Yeah,
um
yeah. You know, there's a line that comes to my mind. Like I interviewed. I was approached for an interview by a Black man who does race play in relation to some, and I speak about that also in the book. And I've been thinking a lot about that interview, and I wrote something else after I published the book, where I came to this line, which I've been so preoccupied with, which is such a simple line, but like, I feel like I've had to do so much emotional work, especially to push back against my training to be able to say it, which is, why is it so hard to accept that all of us are broken and that we're all working from within our own brokenness, rather than there's a person who's not broken, who's minding the space, who is kind of like trying to like offer like a safe space, as you were saying earlier. Maybe they get it wrong, but they can get it right if they're better trained, if they're more aware, if they're this is not to abandon the responsibility that comes from having a position of um, being in a position of care. I'm not arguing for that at all. It's about taking seriously the fact that in any relationship that lasts long enough, injury will happen. How big it's going to be, how critical it's going to be, how sadistic as opposed to accidental it will be, like, varies, of course. But this is what it means to be in encounter with each other. And when you throw sexuality into that, you're playing with these forces, kind of like the forces of the sexual death drive, which are not just destructive, but they're also energetic and can open up to all kinds of other possibilities. Like you're in like high voltage conditions. And this is much of the reason I think why people step away from these kinds of experiences, because they're frightening and because they're not for the faint of heart.
yeah. And I think what you're talking about too of I can't I'm paraphrasing what you're saying, but we all are so broken. We all have been broken. We all have experienced some trauma in like our formation of self, of who we are now. And I think the very traumatophobic stance is that you shouldn't be able to touch that brokenness. And I think what the book is an invitation for is to be open to that brokenness, and it also offering that opportunity to share yourself, not in like your whole best self with someone, but like in your trauma and in your brokenness, and to actually invite someone to touch the wound with you. I feel like is such an incredibly moving and powerful experience that we get to explore in BDSM. But I do want to ask you, I feel like writing this book and the books that you have been writing in your writing are also a form of risk taking that you take in your academic practice, talking about consent this way, like exploding affirmative consent, and in gender without identity, talking about how all gender formation can come out of trauma. I feel like are very big things to be talking about and are risky things to be talking about with very real and high stakes. And I guess I'm curious,
Yeah.
as we wrap up the conversation, what has professional risk facilitated for you, and what has come out of bringing, these wounds and presenting them with your theory brought to you, and have you
Yeah.
noticed?
Yeah. um, Writing this book did feel like a very big risk. And I have been I was very excited to write it, but also very frightened of it, including frightened of things that would come up in myself as I was writing it, and then frightened of how people would react to it. And for different reasons, I've also been frightened about gender without identity. And Anne and I, we write this book, we discuss that fear very explicitly. But look, at the end of the day, for me, what feels important is, perhaps it's because I'm a clinician. Like, I sit with people and hear people talk about these things in depth over multiple times a week over many years. And I have seen, like, we were very relieved, for example, when we started talking about gender without identity and the notion that trauma may have something to do in the constitution of gender, normative and non-normative gender. It's okay to say that about cisgender, but in our circles, like queer leftist circles, kind of like the idea that trauma may have something to do with the constitution of trans genders that are trans, or kind of like more atypical, or kind of like non-binary, is a faux pas, because it's scary. Like, I think we talk about it sometimes with each other in our private conversations, but to put that in the public conversation is frightening because of how it could be weaponized. But at the end of the day, and this is my short version of the answer to your question, is I think that our communities deserve the dignity of complexity in a way that we have been deprived of them, in the effort to make ourselves look legitimate or non-pathological and speak the language of normativity and of hegemonical structures that has also oppressed us. So for me, complexity is actually, it's pro-trans, pro-queer, pro-pervert, pro-sex work, pro-abolition, pro kind of like a disability rights. Like, to speak complexly is actually to protect us. It's not to damage us, and we need to dare speaking more complexly. So thank you for that question. Actually, I think it's really critical for me.
Well, thank you so much for this conversation. I really appreciate any opportunity to chat with you.
Mm-hmm. This has been a lot of fun, and you've given me things to think about that I wouldn't have thought before. So I really appreciate it. Thank you for having me.